Welcome to Holistic Health for Happy Kids, the podcast where we dive into the root causes of children's health challenges and explore natural solutions to help little ones thrive. I'm Lisa, a passionate paediatric naturopath and mum of 3, dedicated to empowering parents with practical tips and expert insights to raise healthy, happy kids. Each episode will unpack common childhood health concerns like allergies, eczema, fussy eating, and gut health, and share evidence-based advice to support your child's wellness naturally. Let's create a generation of thriving children, one holistic step at a time. Thank you for joining me on this journey. Welcome to today's episode of Holistic Health for Happy Kids. And today we're speaking with Dr Elina Castro, who is an airway-focused dentist in Sydney. So Elina, tell me a little bit about yourself and how you became focused on this aspect of dentistry.
Okay, my name is Elina, like I said. I'm coming from Brazil, so I've been a dentist for 30-something years. I came to Australia in 2003 and I did the Australia Dental Council exams. In 2006, I finished, and since then I've been working in dentistry in Australia. But it wasn't until something happens to my own that I start looking at dentistry in a completely different way. So just summing up, I only have one daughter, and because I didn't have a child to compare anything, so I thought, oh, should be it, should be it. But her story is that from the age of 2.5 to the age of 5, she had tonsillitis non-stop. And then I was taking her to doctors here and back in my country when I was there, going on holiday, and they always prescribing the antibiotic, but never asking about her sleep pattern and her mouth breathing. So when I actually have to say, when I met Dr. Mahoney, he was back in 2015. I went to a course and he was talking about airway, and things started to make so much sense to me. And I thought I need to go deep into it. And I started learning more and more from about what that was and how could I have missed it so much. But we can't regret what happened in the past, but you can change what comes in future. So from then on, I start looking at every child, everywhere actually, but with adults, it's different because you can't make much of changes. But in children, I start looking at them in a completely different way. And I wanted to help those people because I went through that. So I wish that I had the help then that could avoid so many trouble with me and my daughter. But I guess things are not a coincidence. They are for a reason. Because of my daughter's issue, I became what I am now.
Yeah. And what's the difference between an airway-focused dentist and a holistic dentist, or are they the same thing?
No. Holistic dentist is mostly those dentists that don't like to use amalgam and products that contains these or a lot of chemicals. This is a holistic way in a kind of material. But yes, it can be holistic in an approach of the airway, but not many of the holistic dentists that work with no amalgam, this and that, no fluoride, no this and that, we will understand about airway. And the ones that are doing airway, they really holistically seeing the face and the person and really not focus on non-fluoride, non-amalgam. No, these two different things.
Yeah.
Yeah.
So I talk about, I talk about dentistry generally with all the kids that I see, but in particular about the airway side of things. And so, what are some of the signs that I should be looking for in a child to think that they might have an airway or some sort of breathing issue that they would need to see an airway-focused dentist?
Lots. Okay, lots. When you learn about it, you actually can see in the streets. So I
Yeah.
used to go for my friends' photos on Facebook and then send them their message, Nina, I need to see this child. Well, first, most important, open lips posture. Those kids with the lips open all the time. So go for the lips that look fat, the lips that have that kind of heart shape. The upper lip is short, so they physically it's difficult for them to get the lips together because of so much mouth breathing. So this is the main one. And second, protruded teeth. So especially with the kids one, that the moms come desperate to the dentist because they had a fall and broke their front tooth or front teeth. It's so common to see that those kids are actually mouth breathers because the lips are open all the time. There is nothing protecting the teeth from the heat or the trauma. So the first thing that happens is you got your teeth affected, and then you come to the dentist, they fix the teeth, and then forget about it. No, there is a big reason behind it. Then you look at the dark circle eyes around around the eye, dark circle around the eyes, drooling, too much drooling. The teeth, the child has all their teeth in the mouth while they're still drooling. This is another one. Then we have picky eaters, very common. Children, slow eaters, very common. Sleep disorder breathing, such as snoring, teeth grinding, nightmares, bedwetting, um, tired during the day, hyperactive, difficult to concentrate, difficult to learn. So all of that is coming from one thing, breathing.
Yeah. I went to your 1 day seminar back in August. And
Yes.
since that point now when I'm at summer soccer or at the school or whatever, I am looking at the kids going, oh, he can't close his
Mm.
mouth. They're like
Yes.
looking at, especially that lips that the kids that walk around
Yes.
constantly catching flies, I would say.
Yes.
And whenever people go to the dentist or to an orthodontist, often they will just be told when they have concerns, they'll be told, like, come back when you're 14 or you're 15 and we'll talk then. So I know you approach things differently. So what would be the youngest age that you would start to see someone for these issues?
Okay. I went to a course, and it was one of the questions to the professor was that question, and he said, "In the wombs, the mother's wombs." Okay, why? Because we can educate the mother. We can educate the mothers about pacifiers, about bottles. I'm not saying that they're not going to use it because I use it myself, but they need to understand the consequences. So we educate them about tongue ties as well, about the way to breastfeed, the breathing. And but in the surgery itself, between up to the age of 2, I access mostly the airway, identified airway issues, identified tongue tie, identified already issues that are not going to solve themselves for the sake of it. And then I refer to a ear, nose, and throat or oromyologist and speech pathologist that can treat that functions then because structurally I cannot do much because of their age. From the age of 3 onwards, then I can fix everything. I can fix crossbite, underbite, open bite. It depends on the child's cooperation and how the parents are on board.
Mm. But I assume
Yes.
because at the age of 3, kids are growing rapidly. So even if compliance isn't great, you're taking advantage of their growth at the same time.
Exactly, exactly. At the age of 3, I have a lot of dental facial growth ahead of me. So I'm going to use this on my side. So even though I cannot do, for example, those techniques developed by Dr. Planners a long time ago, they correct cross bites, underbites, overbites at any age. And I don't need the child's cooperation and wearing anything, but I need them sit in the chair. So sometimes what I do, I start with oral myofunctional appliance first to get them nasal breathing, to get them with the tongue the right spot, and then I get a relationship with them, then get trust. And then if I need to do something dentally, like this technique called direct to track, then I'll have the child in the chair and I can do that, no problem.
Yeah.
As early as possible.
Yeah, I mean, you said one of the things to look out for is hyperactivity because, of course, tired kids can go either
Hmm.
way. They can be lethargic, and they can be
Yes.
hyperactive, and that's not something that if you go into the general, like medical system, so you go to your doctor, you say my child's hyperactive, then you get sent to a behavioral
Yes.
pediatrician. or developmental pediatrician, but the doctor will very, very rarely, if ever, say, go and see about your airway, which is
Yes,
such a
unfortunately.
shame.
Yes, it's a shame because for me, I think you need to think of your body as a one. So, how many days can you live without food? How many days can you live without water? How many minutes can
Mm,
you live without air? So, we need to focus on the airway because this is the main thing for the body. If that is not functioning, nothing else will. It will adapt, but that doesn't mean it will be good. And
mm,
there is a price to pay for it.
mm. So how do you, like, what tools do you use to assess a child's airways and their craniofacial development?
Okay, first of all, just looking, I can tell. I actually have some parents that bring one child to see me, but bring another one with them along. And I go, I want to see that one too. So sit in the chair. The face tells a lot. Like I said, retruded mandible, mandible too small. I don't need to look at the teeth to see that there is an overbite or an overjet. That means the top teeth are too far from bottom teeth. Um, Crossbar, this Mario is crooked. Okay. Open bite, the tongue is poking. So those things I can already, before the child sits in the chair. Then when they sit in the chair, I'll check how the teeth are meeting. Okay, that's what dental malocclusion is. The way the teeth are meeting are not corrected. Therefore, the growth around this face cannot be corrected because the information for the growth here is dependent on the teeth, but they need to meet. Then I assess them. Sometimes I can see the tonsils, sometimes I can't, depending on the child's cooperation. Tongue tie, I assess too. Lip tie. So these things are in the chair. Yeah. But the
Yeah.
face tells it before you.
And are you able to, so say if someone does have a tongue tie or lip tie, can you address that, or do you need to refer them on to somebody else for
I
that?
refer. I refer. First of all, there are two things. One thing important for us to understand, and this is a little a comparison explanation I give to my patients. So tongue tie, depending on the severity, it should be addressed. It should be released. Okay, so the mandible can move free and the tongue as well. But if you have a dental malocclusion where the space provided for the tongue is a very constricted, narrow, releasing the tongue is not make much of a difference. So we actually need to create a better space for the tongue so then you can release and the tongue can behave differently. Because what's the point? This is a comparison I do. Let's say I live in a cell, very small cell, and I have my ankle attached, chained to the wall. Then someone comes and release my ankle from the chain. How much can I move? I'm still in the very small cell. So I need actually to create proper space so the tongue can actually move. Otherwise, you can have a lot of problems with scar tissues with the tongue because the tongue is doing exactly the same as before. So
Mm.
no much change. Yeah.
Mm. And so palate expansion. So
Mm.
tell me, what exactly is palate expansion and what does that involve?
Okay. First, our first and natural palate that will expand is the tongue. So the tongue, every time the tongue goes against the palate on a swallowing movement, it causes forces against the palate, which make them wide. So the tongue is actually the template for the palate. Then when the children, when they are very small, I can use an appliances that keep the tongue against the palate. It forces the swallowing with the tongue in the right position, right? And also at nighttime. When the child is a little bit older, the tongue of the force, depending on how severe the constriction is not going to be enough. Then we have different types of palatal expander, but most commonly we have the removal ones which are made on the lab, and the child has to wear. And every night the parents give a little twist to make it large. But we are very dependent on the child wearing it. And the fixed one, which we put it in there, and the child cannot be compliant or not because he can't do anything. And then the parents do the turns every night, and then we get the false palatal expander. So you basically get this.
Yeah. So if
So
you're listening to this, there is a YouTube video and we'll be able to look at different things. So just if you're
yes,
listening to this and you're confused. And so what age would be the earliest where you would do that, either the fixed or the removable? What would be the absolute earliest age you would consider that?
two.
Two.
Two, two, because two, I can already give some appliance to train nasal breathe and chewing. So these are the earliest. Obviously, we do have a lot of growth in front of us, but you don't have as much compliance. So you kind of, but at least we're doing something. The best age to work with, 3 to 4, 3 and 4, because there's more compliance and still lots of growth ahead. Yeah.
I started with my son when he was 9, and even then I had to twist the person's arm. It obviously wasn't you. I had to twist the person's arm to do it at such a young age.
Mhm.
And like he's a bit of a, well, I knew compliance wasn't going to be easy, so I basically just made a deal with him. We're just going to wear it at night. And that, so it was a twin block. So we'll just
Yes.
wear it at night. And even with that kind of 50% compliance, he's still got the exact achieved results in like the desired time. So I think it's with everything. Parents think, oh, it's too much, I can't do it, because they think that it's 100% or nothing, like with food
Yes.
or, removing toxins from your family or going organic. But it's never 100% or nothing. You can do what you can do, and it's still better
Mhm.
than nothing.
Yes, and I see this all the time here too. So I ask the parents to wait, okay, 1 to 2 hours during the day and the whole night. And, and sometimes I get it, sometimes I don't. But if they wait a little bit, we see the difference.
Yeah,
It will take longer, but we can see the difference. And you'll be surprised on how adaptable these kids are. The
yeah,
parents says, oh, I don't think they're gonna wear it. Do you think they're gonna wear it? Yeah, they will. And they do. And sometimes then you remind the parents.
yeah.
It's amazing. Yeah,
Yeah, because they probably feel better, so they know that they're actually
exactly.
able to breathe better whenever
Exactly.
they're getting better. Um, and so would you do a fixed expander with such a young child, like 3, 4?
No,
No.
no, no. Okay, this is mine. This is my idea. So there are people that do, there are people that don't.
Yeah.
My understanding is the bone is too malleable. Okay, so to do something that it's fixed it, that even though you do gently and slowly, and we're still breaking the suture like
Yeah,
that,
yeah,
right?
yeah.
There are structures on the top of the palate. The base of the cranium is that too. So you doing that, you're also forcing the other bones apart.
Mm-hmm.
So the tongue is the one that should be doing this job. When the sexy old molar come through, then the palate is more stable and then I feel more secure. But even that, I still wait for the centrals to come through and do the palatal expansion. Very rarely I do it without the centrals. It's when there's no way those front teeth are going to come through because it's so crowded here. So then we have to do two lots. We have
Yeah.
to do the first lot just to create space for the centrals to come through. And then later on, when it more advanced dental mixed dentition, we need to do it again. Yeah.
Yeah. And is there an age like where it's too late for this? I mean, I talk to adults all the time who are getting
Mm.
severe like jaw orthodontic type work, like surgery, like in their 30s or 40s. Obviously, there's a point in time where you can't use growth for the expansion. What would
Yes.
be the age where you can't, just using the expansion isn't going to work?
Okay. So there's not much. People don't agree. One says one thing, another say the other. Okay. The suture in adult age, it's fixed here.
Yeah.
Okay. So they explain that what they say that happens is you can't split the suture anymore. When you put the expander, we actually make the teeth go like that. So you actually moving the teeth like that, which can push them out of the bone.
Mm.
This is what some say. The others say, no, it's safe to do. What I can tell you is, first, the body remodels all through our lives. Depending on what appliance you're doing, you can achieve it. In Brazil, we have what we call jaw functional orthopedics, with some appliance that I used, and they expand the palate, obviously in a slow motion, obviously not as good as in early age, but it can do by via stimulus. So the bone is going to grow according to the muscle demand. So if there is a right stimulus to the bone, it will grow accordingly. Okay, so they are used in adult age and they work. They work beautifully. A maxillary expander, like the fixed one, it's more limited after the age of 16, 17. Yeah.
Yeah.
90% of the face is finished grown by the age of 12. So we working with 10%, where you can work with so much 50% at early. But
Mm.
I guess we can try at any age. Results are
Mm.
reduced though. Yeah, not as good.
And of course, when I was a child a long time ago,
Mm.
we didn't bother with expansion. We just took the teeth out. So I got
Mm.
at least six teeth just pulled out to make room, and it was horrendous. I remember sitting in the chair
Yes,
getting them pulled out, and it was so
yes,
silly, like just such a waste of the good teeth.
yes, yes. Look, I know as there's still people that do it. I don't say you don't have to do. There are cases that you have to.
Mm,
But these cases nowadays are very small,
mm,
especially when you treat early. When you treat early, the chances of you having to remove teeth are minimum. And when you remove teeth to fit the other teeth, we forget about the tongue. So you make the mouth smaller to fit all the teeth because well, your mouth is already small. That's why the
yeah,
teeth are crooked. Then
yeah,
you take the teeth out, so you continue to be small. But the tongue,
yeah,
what about the tongue?
yeah, yeah, no change. So
Mm.
one of the big aha moments or like blow my mind moments at your seminar was the link between eyesight and malocclusion. So I'm
Mm-hmm.
sure most people listening to this have never heard of this link. So can you explain the
Yeah.
link there?
Well, there are different ways, but mainly is remember how I mentioned before about bone is going to grow according to the muscle demand. So especially when you have crossbites, so crossbites for me are one of the worst for the growth and development of the face because you're supposed to have your mandible right in the middle, right? So when you chew one side, you chew
Yeah,
the other side, and you give information to this bone similar to this bone. So the brain is going to respond according to the movement of the mandible, right?
yeah,
So if you have a crossbar, you're going to have one side being overused in the other side.
yeah,
Just above it, it's what? The eye socket. Okay, so the pressure of that bone growing, for example, on one side, that it's a lot of compression, the other side not as much. So obviously that bone around it is going to grow different than this one. And then the eye is going to have different tension of the muscles and even the innervation. And so then you can have eye issue, right? And you can have vision issue, and also temporomandibular joint innervation. It's also the trigeminal nerve. It's also coming up to the eye, right? So the stimulus here, saying to here, can cause tension on the muscle there, can cause different behavior, and therefore issues.
yeah,
I watched this film by a doctor in Brazil, Dr. Patrícia Valéria. She even have a paper. If you want, I'll send you the paper
yeah,
where she talks about it. It was a research actually. So I'll send you the paper for you to read. It's amazing, amazing. Well, we're only one unit,
yeah,
you know, so we
yeah,
can't just move pieces away from each other.
yeah. We're just a big
Yeah,
jigsaw puzzle.
yeah.
So when we work with really fussy eaters, we'll often get them to send in a video of the child eating. And often they're just chewing with one side. Like you can see the food goes in and it just goes to one side. It's not going to the other side at all.
Yeah.
So, could that be a sign of a cross bite?
Yes,
Yeah.
but also overbite. My daughter, for example, do you remember the photo that I
Yeah.
was there? So That asymmetry, luckily, was not born yet because she was very young then. But the muscle asymmetry came from unilateral chewing, and didn't have a crossbite. She only had overbite. It was a severe overbite though. So what happens is, because of the space for the tongue when an overbite, so the tongue tries to find a compensation to be able to chew the food properly, because the teeth are not meeting. Teeth need to meet teeth. Otherwise, you can't mash the food properly. So the tongue is doing all this job trying to get the food mashed, and usually you get one side that is more comfortable, and you keep doing that, and that becomes a habit. And then you have that there is the unilateral chewing. It's a lot of. I have cases here where I see because I asked for the X-ray for the face, so for the frontal cranial, with massive, absolute massive asymmetries already in the bone front unilateral chewing. It's amazing.
And you would
So
even then develop the muscles on one side for chewing, for chewing and
yes,
speaking on one side, and not develop the
yes,
muscles on the other
yes.
side.
And don't forget, never forget the temporomandibular joint, which is linked to the mandible, which is only one bone. So two sides need to work the same. If they don't, one side, the disc here on the side of the chewing will be compressed. The disc on the side of the movement, the lateral movement, is going to be extended. So they're growing like that. So the stimulus sent to one side is going to be different than the other. So the bone is going to grow larger and longer on the side is not chewing, and shorter and more compressed on the side that chews. And it's
Yeah,
forever, because after the growth, what are you going to do?
yeah. So we've talked about, well, I think we mentioned sending people like to oromyofunctional therapists. What
Mm.
other practitioners do you kind of collaborate with on these cases?
Oh, as many as I can. So I work directly with speech pathologists and oromyologists. These are my always team with me. Obviously, I work with my orthodontist as well, because I do the little ones, he do the big supplies. So I work very well with him. I work with a sleep physician, Dr. Virginia specifically, Virginia Oliveira. She's fantastic. ENTs, gosh, every day, at least 3 to 4 referrers per day to ear, nose, and throats. And also chiropractors. Oh yeah, chiropractors. Because I need them to help me to put the head in the center.
Mm,
Obviously, with a crossbite, let's say a crossbite, without correcting the crossbite, you're not going to be able to align the head, because the movement of the chewing is constant throughout the day. It won't be able. So we need to work together. We all need to work together. I can't fix the function. I need the oromyologist, the speech pathologist to help me. They can't fix the structure. So they need me to help. So that's why we work together. It's amazing,
mm.
amazing, amazing. And hopefully with you too, because you know what? Food allergies can cause breathing issues, which can cause dental malocclusion.
Yeah,
There you go.
absolutely. Um, what about craniosacral therapy? Do you ever work with craniosacral therapists?
No, I haven't,
Gotcha.
but because I don't know anyone. But if
Mm.
you have names, I would love to.
Yeah, I am. I had my first treatment last week and it was
Uh-huh.
incredible. So I'm kind of going down that path of what else could this be good for? But I imagine it would play some sort of a role. So far we've got if your child has a speech issue, an eye issue, ADHD, picky eating, sleep issue, they should come to see an airway focused dentist. So that's
Yes.
pretty much every single child that I deal with. What else would you really like to share with the people listening that we haven't already covered?
Okay. Yes, I do. I would like the parents to keep an understand airway, because I have people that I say, look, this is what's happening, and blah, blah, blah. And then some parents are on board straight away. Others are not. If it's important for us to understand, we're treating a person that is forming. So everything counts. Everything. the breathing counts, the sleep counts, the eating counts, everything counts. In ignoring a condition that is showing it's not going good, it's not going to fix itself, it can't. Once the structure is messed up with the function, waiting is not going to change anything. On the opposite, it's going to make it worse. And the one paying the price is the child in their future. Okay,
Yeah.
so it's important for the parents because the parents, oh, they're too early, it's this and that. The best time to treat a problem is when it appears, when it's diagnosed. Waiting for something to fix, not a good idea. Nobody goes to a doctor and the doctor says to you, I think you might be developing high blood pressure or diabetes. But let's wait
Yeah.
until you get the diabetes or the high blood pressure so we can treat. Doctors do that. So dentists need to understand that we are the gate. Yeah, everything goes through here.
Yeah.
And it's important for us dentists as well to be on board of that because behind those teeth are people. Uh, they're struggling with breathing or not, but we need to identify, we need to learn. We need to learn. Yeah. This is I wish dentists would be more interested in that, but I don't know. I think at the university we don't get much teaching on this aspect, unfortunately. But when it happened to your own, the story is totally
Mm.
different. Yeah.
Yeah.
So yesterday was my daughter's 10 formal. She was
Oh,
beautiful. She never had braces. She have a beautiful smile. Her overbite was fixed. Her airway was fixed. Her airway fixed by fixing the bite, not removing the tonsils and other tonsils, because she had sleep disorder breathing such as nightmares, restless sleep, sweaty, moving a lot in bed, and talk on her sleep. She was tired during the day, difficult to wake up, afraid to go to sleep, would chew her food and spit it out. Oh, slow eater. And those are the noise were removed. 1 year later, all the sleep disorder breathing still present. Tonsillitis not, obviously she didn't have tonsils. All the sleep disorder breathing present. That's when I got the photo with the massive asymmetry in the face. That's when I went to look for answers, and then someone told me you need to work on the muscles on the chew, and you need to increase the space for the tongue. You need to correct the crossbite. And so I did, and that finally changed. And that was what brought me here,
mm.
because if the parents need to know, what is my dream?
Yeah.
Here in Australia, you know how children at school they have speech assessment and they
Yeah.
have eye assessment. There's no airway assessment. No
Yeah.
airway assessment.
And
Huh?
I would add to that, check every child for celiac disease at the same time.
Exactly.
Yeah.
Exactly. Exactly.
It's so funny. Like, obviously, hindsight is a wonderful thing, but my middle child is now 14 and a half, and she, looking back, she had sleep disordered breathing. She was terrible at getting to sleep. She was cranky in the morning. She was sweaty. She was sleep talking. She was sleepwalking. She had night terrors.
Mm.
We would find her like under the desk in her room asleep. Like
Oh,
she had it all. And it's only, now in the last year or two where I've taken such an interest in this, I look back
mm.
and think, oh, well, she
Yes.
probably had some sort of like sleep apnea or something. And she's actually my only child that probably has a good jaw development, but she has asymmetry because when she was born,
Mm.
she was in intensive care for a long time and they left her obviously on one side. So, 1 year, she got the complete like torticollis and
Mm.
which you don't notice now because she's nearly 15 and she's got big curly hair. But yeah, she has asymmetry, which was probably causing airway issues, which
Mm.
was causing all of that. And I just didn't know, even though I've been a nutritionist or naturopath for quite a long time now, I still didn't pick that up with my own child.
Mm.
It's hard to see it sometimes.
Yes.
Yeah.
Yes.
Which is
Yes.
why you just
It's
should
like
do it as a matter of course rather than waiting for clever people to notice these things. You just take your child and get it
mm.
assessed.
Exactly, exactly. My own child, she was changing before my eyes. I didn't notice because you see every day and these changes are very mild. But when that photo came, and I said, what's going on here? I said to her, why is mine crooked like this? And she said, I can only smile like this. And I did not understand. I thought she was just being difficult and she was 6 years old and she was just being the only child, blah, blah, blah. No, because of the way the muscle, the way her chewing was causing those muscle asymmetry. And obviously, one, the nerve irrigation to one side was different to the other because of the work that was done was different. She was going to grow completely asymmetric, and nobody could do anything about her face after the face was finished. And I
Yeah,
could change teeth. We can move teeth on all age. I'm 80 years old. I want straight teeth. I can do it. But the bone
yeah.
and the
Doesn't change.
consequences of it, this is what also the parents need to understand. The consequence. Think about, just finalize about tonsils and adenoids. I'm not again or against or in favor of the removal of tonsil and adenoid. I don't care. What I want is the child breathing
Yeah,
through the nose. That's what
yeah,
I want. So because are they going to grow out of the days of, yes, but at what cost? And maybe not.
yeah.
Okay, so I want, and we need to breathe. If we could breathe, like I think half of our health problems would be gone. Yeah.
Absolutely. And so
Mm.
your business is called Cheerful Smiles Dental. So tell me about, where you're located. Do you need a referral? Can you just phone up and make an appointment? Tell me everything about how
Okay.
to see you.
Yes, Chifu is Miles Dental. We are in Miranda and 2 Gibbs Street, next to the train station, very close to the Westfield. We open every day. You don't need a referral to come in. Just walk, just call and make an appointment. Or if you're not sure what we should do, you can send us an email and I'll have a look, or even you can send a photo of the smile of the child, and then I can tell you, okay, yeah, come and see me, or go straight to the airway,
Yeah,
ear, nose, and throat, sorry, and then come to see me, because that's something as well. For my treatment to actually have good result, I need the child nasal breathing. And doses in adenoids too large are going to be in the way of the treatment, and then nobody wins here. So sometimes I need the airway fixed first, and then come back to me. Sometimes when it's not too bad, then we can train the nasal breathing. We put the tongue in the right place, and that sort out most of the problems. And then the airway, we assess later if needed. But most
yeah.
of the time, we have the airway first.
And
Yeah,
so for people listening, if the tonsils and adenoids are in the way, that's when you see a naturopath because we can help you get the tonsils and adenoids down to the right size so that
exactly.
you can
That's
continue
that's
with
good
your way.
too, because there are lots of enlargement that is caused by allergies from food. Yeah. And then you don't know. So you eat that food all the time, and that is causing more and more enlargement and less breathing. Then you go into the cycle, you never leave. Yeah.
Yeah, yeah,
Yeah. And if needed, if the parents need it, for example, ear, nose, and throat referral, chiropractor referral, or to you, I'm more than happy to refer to whoever needs, because I would like to work together. Yeah,
yeah.
with our
So
professionals.
if you've listened to this and you're thinking, this is my child, I need to see this airway dentist, then Cheerful Smiles, they're in Miranda in Sydney, and just pop them an email and see if that's going to be right for you. So thank you so much, Alina, for giving up your time today. I know this is a really hot
My
topic that a lot of
pleasure.
people listening are going to be very interested in. So thank you very much.
Thank you for this invitation.
Thanks for tuning in to Holistic Health for Happy Kids. I hope you found today's episode helpful and inspiring on your journey to raise thriving, healthy little ones. Remember, small, consistent changes can lead to big transformations. If you enjoyed this episode, please subscribe, leave a review, and share it with other parents who might benefit. You can also follow me on Instagram and Facebook at The Pediatric Naturopath for more tips, tools, and inspiration. If you've got a question or a topic you'd love to hear about, please send me a message. I'd love to hear from you. Until next time, take care and keep supporting your kids in the most natural, nurturing ways possible.